What do high creatine kinase levels mean for muscular dystrophy? Imagine your muscles as busy factories, constantly working to keep you moving. Inside these factories is an important enzyme called creatine kinase, or CK. When muscles are healthy, CK stays safely inside the muscle cells. But if the muscles get damaged or start breaking down, CK leaks out into the blood. A simple blood test can measure how much CK is floating around in your bloodstream. In muscular dystrophy, especially Duchenne muscular dystrophy, high CK levels are often one of the first signs that something is wrong. Duchenne muscular dystrophy is caused by a genetic mutation that stops the body from making a protein called dystrophin. Dystrophin acts like a protective shield for muscle cells, keeping them strong and intact. Without enough dystrophin, muscle fibers become fragile and easily damaged during normal activities like walking or playing. This ongoing damage causes CK to escape from the muscle cells into the blood, leading to very high CK levels. In young children with Duchenne muscular dystrophy, CK levels can be 10 to 100 times higher than normal, even before any noticeable weakness or symptoms appear. But it's important to understand that high CK levels are not exclusive to muscular dystrophy. Many other things can cause CK to rise, such as recent intense exercise, muscle injuries, certain medications, or other muscle diseases. That's why doctors don't rely on CK levels alone to diagnose muscular dystrophy. Instead, they use high CK as a clue to look further. If a child has high CK and shows signs like muscle weakness or delayed motor skills, the doctor will usually recommend additional tests. These might include genetic testing to look for mutations or a muscle biopsy to examine muscle tissue directly. In Duchenne muscular dystrophy, CK levels tend to be highest in early childhood, usually between ages 2 and 5. As the disease progresses and muscle tissue is replaced by fat and scar tissue, CK levels often decrease. This doesn't mean the disease is getting better, but rather that there is less healthy muscle left to leak CK. Monitoring CK over time can help doctors understand how the disease is progressing and decide on the best treatment options. However, CK levels alone don't tell us how severe the disease will become or how quickly it will advance. Remember, CK testing is just one part of a complete medical evaluation. A healthcare professional will consider your medical history, perform a physical exam, and may order additional tests to confirm a diagnosis. If you or your child have high CK levels, it's important to follow up with a doctor who can interpret the results in context and guide you through the next steps. Early diagnosis can open the door to supportive care, therapies, and resources that can help improve quality of life. If you're concerned about muscular dystrophy, knowing that high CK can be an early sign is helpful. But it's equally important to get proper testing and diagnosis from healthcare professionals. This way, you can access the right treatments and support tailored to your needs. Always talk to your doctor for personalized advice, and remember that each person's experience with muscle health is unique. Accurate, timely medical care makes a big difference in managing muscular dystrophy and maintaining a good quality of life.